Welcome to Hearing What Matters, a podcast for Australians looking to know more about their hearing health, hearing loss, and hearing aids. My name is V. Tran, host of your podcast. I do work for Active Audiology, an independent clinic in Melbourne, and my purpose with this podcast is to deliver information that is controversial, independent, honest, for those looking to improve their hearing health knowledge and make informed decisions. Hi everyone. If you've got a hearing loss or you're living with someone who does, you've probably thought about a cochlear implant. Now, Australians were actually the pioneers in this surgical procedure, and the very first cochlear implant was conducted by Professor Graham Clark. So today we've got Lisa Singer from Cochlear Australia to give us an expert insight on what's involved. Lisa, welcome.
Thank you.
Now, Lisa, give us a small insight of what you've done in audiology and cochlear, and what your role is at Cochlear Australia.
Yeah. Okay. So I'm an audiologist, and I studied my Masters of Audiology at Melbourne University. I finished in 2009. And initially I specialised in paediatric diagnostics, so diagnosing hearing loss in children. But then I moved into the cochlear implant space, and I've been working in cochlear implants for about 10 years now, in the UK and in Australia.
Wow.
Yeah. Cochlear implants is a huge passion of mine. I think it's a field that I can't leave now that I'm in it. But I really feel like it's my job to be raising awareness and sharing, that for people that are really struggling with their hearing loss, that there is other options out there for them. We know adults, less than 10% of people that could benefit from a cochlear implant actually get one. So there is a lot of work we have to do in this space to raise that awareness.
And what I like about your background is you can give us perspective on people who want hearing aids, because you've worked in that area, and then also those that have done really well with cochlear implants. Yes. Fantastic. So tell me, for those that haven't really embarked on this journey, what's a cochlear implant and how does it work?
Yes, okay. So a cochlear implant works quite differently to how a hearing aid works. And I think to understand how a cochlear implant works, it helps to understand how the hearing aid works. So a hearing aid, as I'm sure most of the listeners would know, many people probably have hearing aids that listen to the podcast. They will have something that sits on the outside of the ear with a microphone that picks up sound from the environment, takes the sound into the inner ear to be processed through the normal pathway that's working well to the brain. And that works really brilliantly for people that have a sort of mild to moderate hearing loss. Mm-hmm. But when you have a more severe to profound hearing loss, usually that's because the little nerve fibers in the inner part of the ear or the cochlea are not working so well. So with the hearing aid, no matter how loud you turn up the volume, you're not getting a clear signal to the brain. So you're going to be still struggling in different listening environments. So what a cochlear implant will do is it's there to replace the damage that's happening inside the inner part of the ear or the cochlea.
Like a bionic ear?
Yes. Yeah.
Right.
Exactly.
And so you mentioned about more severe hearing loss, making you a candidate for a cochlear implant. I don't know what type of hearing loss I have, so what type of journey do I have to have gone through to qualify for a cochlear implant?
Yes. So I think the very first step, if you're struggling with your hearing, is to see an audiologist or an audiometrist to have some testing done to see what your hearing is like. Usually before someone gets a cochlear implant, they would have a hearing aid, because we want to know that someone how they're doing with their hearing aid. If they're doing beautifully and they're hearing well and it's improving their listening, then great, that will be the perfect solution for them. But if they're struggling still to meet their listening goals with hearing aids, that's when we would encourage people just to have some testing to see if they could benefit from a cochlear implant.
Great. Okay. Right. So if I am considering a cochlear implant, what are the benefits, and conversely, what are the risks involved?
Yes. In terms of benefits, usually when someone gets a cochlear implant, it's because they're still struggling in certain environments. So the main aim with a cochlear implant is to hear speech better. We would expect people to hear speech better if it's recommended for their hearing loss. If they were able to hear on the phone previously and then they've lost that ability, usually with a cochlear implant they should be able to hear on the phone again. Potentially they would hear better in background noise. So they should be overcoming some of those challenging listening situations, being able to hear a little bit better than what they did with their hearing aid, if it is recommended for their loss. In terms of risk, it's a very low risk procedure having a cochlear implant. And it would only be recommended if someone is expected to do significantly better with a cochlear implant than what they are doing with their hearing aid. So,
right.
When it comes to other risks, that would be discussed with each person, depending on their history, by the specialist involved in the cochlear implant program.
And is it a hospital, is it a surgery?
Yes, so there's a surgery involved. There is an implant that goes under the skin. Usually there is a little incision that goes behind the ear, usually a couple of centimetres, to put the implant in. And that is done usually over sort of a 1 to 2 hour period. People would stay overnight in Victoria, and then they would go home the next day.
Okay, and can I feel it or see it if I've got long hair or short hair?
Yeah, if you sort of pressed on the skin, you might feel that there's something under the skin, but you won't see anything with the implant. With the cochlear implant system, there's two parts. So there's the implant that goes under the skin, and then there's what we call the sound processor that sits on the outside, which looks very similar to what a hearing aid looks like. That part you can see. So at night, someone would take that off to go to sleep. It's just connected through the skin by a magnet.
Right.
So it's easy to come on and off. When that's on there, you can see it. If you've got hair, that would just cover over it. So in your situation, for anyone watching, with long hair, you wouldn't see it. But yeah, otherwise you can see it. If the bald men, you can definitely see the cochlear.
Sure. Does it hurt, Lisa?
Does it hurt?
Yes. Does the surgery hurt, or does the recovery, is that tricky, that process?
Yeah, so I guess it's like any surgical procedure. Usually people report very minimal pain with a cochlear implant procedure. But I would recommend that anyone that's exploring it speak to other people that have gone through it, get their perspective, and also the specialists too. They'll be able to give people an understanding. But I would say it's a pretty low pain procedure.
How do people speak to other people who've gone through the process?
Cochlear have a service called the Buddies program, and they can connect people that are investigating cochlear implants as an option to people similar to them with a similar history. So it might be if they've had a very slowly progressive hearing loss, or maybe they had a sudden hearing loss. There's lots of different situations. So they will try and connect with someone similar so they can speak to them about what their journey was like. Also, there's information sessions that run throughout the whole state and the whole country, actually, where you can go and hear from an audiologist about what is involved in the procedure. And there's always a recipient of a cochlear implant there who's there to share their journey also. So you can hear also in that setting from those sessions. And they're available to see when they are. They're actually on the Cochlear website also.
I will share that to our listeners.
Yeah.
Lisa, can you share with us stories of those that have had their life changed where they weren't able to get the benefits from hearing aids?
Yeah, it's hard for me to share like a specific story of someone, but generally speaking, we hear beautiful stories of people being able to hear their grandchildren speak, or if they had stopped working because they were not hearing well, being able to go back to work, being able to be social again, go back to the bowls club. Usually we hear really lovely stories of the impact that it's people, because we know having a hearing loss can be incredibly socially isolating.
Absolutely.
People will often be at home and not wanting to socialise because it's exhausting and missing a lot of the conversation. So I think it's quite empowering for people to get back into the world.
You mentioned people going to bowls or hearing their grandchildren again. What's the age range that a cochlear implant can be carried out?
Yeah, so we find there's lots of misconceptions in this space. I think a lot of people would think cochlear implants are just for children, but no, there's no upper age limit for a cochlear implant. The oldest person that I'm aware of that's had a cochlear implant is 102. So there's definitely no barrier in that space.
Wow, and children as well.
Yeah, children. And we find 95% of children that could benefit from a cochlear implant get one. They usually have testing done when they're newborns, or it's picked up by the school and they're referred, they have the assessment and would get a cochlear implant. But adults, that's definitely not the case. There's a lack of awareness in the space. And so, yeah, as I mentioned earlier, less than 10% of adults that could benefit from one actually get one.
Wow. So then talk to me, if I am really considering this option, what's the timeline and the process from going to Cochlear or going to the audiologist to actually conducting the surgery and being able to hear again?
Yes.
What's involved there?
So usually you would go see an audiologist initially that specialises in cochlear implants. And that the wait time for that would be usually pretty quick. It depends where you are, but there's places all over in Victoria anyway, all over the state where you can have an assessment done. And I should mention on Cochlear's website, there's something called Find a Clinic. You can put in your postcode and it will show you where the closest cochlear implant clinic is.
Great.
So you would go see the audiologist for a full test of essentially to see how well you're hearing with your hearing aids. That appointment usually goes for a couple of hours. And then those results would be sent to an ear, nose and throat specialist, and you would go see an ENT or an ear, nose and throat specialist to have a full examination of your ears, of your health. Usually they would order an MRI and or a CT scan. And then all those results would be discussed by a team of audiologists and ear, nose and throat specialists to decide whether you should have a cochlear implant or not. And what happens from that point is if a cochlear implant is recommended, or even if it's not, you would go back to see the audiologist who would discuss everything with you. And if the cochlear implant is recommended, the person can decide at that point as to whether they want to proceed or not. So it's a really good thing to undergo that so people know what their options are, even if they're not sure if they would even go ahead. If they do decide to go ahead with a cochlear implant, that's when the surgery would be booked. And that can be a few months before that surgery happens.
Right.
It depends if someone's going down the public or private route.
Okay.
In Victoria, the funding is incredible, so it's actually quite a short wait list through the public system.
Wow, even as an adult?
As an adult?
Yeah.
Yeah. And so once the surgery happens, usually that procedure is a couple of hours. You would stay overnight in the hospital and go home the next day. After that, it's usually 2 weeks before you go back to see the audiologist. That's when you would get the sound processor or the part that sits on the outside. That's where you would be given that, and it would be switched on for the first time.
And what does that feel like?
Yeah, so obviously I haven't undergone the procedure myself, but I've spoken to many people that have, and often people will report it sounds like Daffy Duck underwater is a really common one that I hear, or a robot.
Right.
It can sound quite strange. The brain is amazing, and usually over the minutes and the hours and months afterwards, it starts to become more normal.
Right.
Really, the objective of that first appointment or that switch on is just for some sound to go through. So some people might just hear beeps and buzzes. They might not hear speech at all. That's absolutely fine. We just want some sound going through.
Okay.
So it really varies depending on the person and what their history of their hearing was.
Wow.
Yeah.
So is it all the hospitals that offer it in Victoria?
Yeah, so not all of the hospitals. So the Eye Hospital, St Vincent's Private, St Vincent's Public, Epworth and the Royal Children's Hospital are the sites at the moment that offer services. So in the metro region, I would say all the audiological services can be done locally, so all across regional Victoria. So that would be the assessments, the testing, all the programming, or what we call mapping.
Right.
It's just the actual surgical procedure that's done in metro Melbourne.
Understand.
Yeah.
So if after listening all this, I'm sitting at home and I want to explore this process, I may or may not have child hearing aids, what do I do? Yeah,
I would say first step is go see a hearing professional and get them to assess your hearing. Usually people would have had hearing aids before they explore a cochlear implant. We want to know that they're not getting the benefit they need from a hearing aid before they get a cochlear implant. If someone has questions and wants to find out about cochlear implants, of course they can speak to their hearing health professional, but also they can contact Cochlear engagement team to get some information about that and discuss their situation.
We'll post all those details on our podcast. Yeah. Lisa, thank you very much. It's an area that's really, well, like you said, there's a lot of misconceptions and an unknown area for those that are suffering with a hearing loss. So appreciate all the information, and hopefully this will trigger a response or at least some interest as well from our listeners.
Yeah, thanks so much.
Thank you.